Assalamu alaikum, hello, and welcome to No Fluff with Omaima Sheikh. Today we are honored to be in presence of the one and only Dr. Saida Budul Mazhar. Assalamu alaikum, ma'am. How are you?
Walaikum salam ji, I'm good.
मैम मैं आपको मैम ही बोलूँगी क्योंकि आप मेरी सीनियर हैं एंड व्हेन वी जॉइंड व्हेन आई वाज अ रेजिडेंट एट पिम्स मैं भी आपको यही बता रही थी कि पहली दफ़ा आपको मैंने वहीं देखा ग्रैंड राउंड में बिकॉज मेरा डिपार्टमेंट ही सर्जिकल साइड पे था सो फर्स्ट टाइम मैंने आपको वहाँ देखा एंड जैसे वो न्यू डॉक्टर्स ज्वाइन करते हैं ना तो वो एक कोई सीनियर कंसल्टेंट होती है करिज्मेटिक सी पर्सनालिटी नो फ्लफ
Very kind.
आई
You're
हैव
too
टाइटल
sweet.
नो फ्लफ नो बटरिंग
Okay.
बट सीरियसली
Okay.
एक
Bless you.
इंस्पायरिंग होता है ना एंड देन व्हेन
So,
यू लेफ्ट द ग्रैंड राउंड जब आप जाती थी वापस मुड़ के हम पीछे पीछे आते थे आप कितनी मोटी सी ब्रेड एंड यू आर टॉकिंग विद द
bless
रेजिडेंट्स
you.
so
Good times.
yeah all that nostalgic so ma'am for people who don't know वैसे तो आप माशाल्लाह इतनी famous हैं within medical fraternity and people and patients as well but for people who don't know mashallah madam is FRCOG FCPS CHPE obstetric and gynecologist consultant, former head of department, MCH Center, PIMS. और मैम अब बिगिनिंग हमने स्टार्ट किया प्रोग्राम का सो आई विल जस्ट लिंक इट विद द अभी 7 अप्रैल को ही किक ऑफ किया WHO ने इसका थीम है साल का हेल्दी बिगिनिंग होपफुल फ्यूचर्स सो मैम इसमें आप तो बहुत बिजी होंगे आजकल क्योंकि आई एम सो थैंकफुल बिकॉज आप वीकेंड पे मैं लोगों को बता दूं ये हम लोग अपलोड तो मंडे को करेंगे बट हम वीकेंड पे रिकॉर्ड कर रहे हैं एंड दिस इज योर फैमिली टाइम एंड यू गिवन अस सो दिस टाइम एंड सो ग्रेशियस ऑफ यू मैम जब मैं डाटा देखती हूँ WHO की ही डाटाबेस से मैं चीज़ें देख रही थी मैं तो एक हॉक आई के व्यू से देख रही थी आप क्योंकि इकोसिस्टम के बीच में है यू आर द चेंज मेकर इन द वुमेन हेल्थ फील्ड तो आप मुझे बताइएगा इफ दिस इज इनकरेक्ट बट मैं कुछ जब डाटा देखती हूँ थोड़ी डिस्टर्ब होती हूँ बिकॉज WHO का टारगेट है SDGs बेसिकली हैं बट द टारगेट बाय 2030 जो MMR का इन्होंने दिया है मेटरनल मोर्टेलिटी का उन्होंने कहा कि 70 टारगेट है पर 100,000 लाइव बर्थ्स अब थोड़ा सा मैं आई एम सॉरी थोड़ा सा फ्रेज लंबा हो रहा है बट लोगों के लिए बता दूं कि मेटरनल मोर्टेलिटी रेट ये है कि जब 1 लाख औरतें जो प्रेग्नेंट हुई भी होती हैं उनके जिंदा बच्चे जब पैदा डिलीवर होते हैं उन पे जितनी मदर्स की डेथ होती है दैट इज मेटरनल मोर्टेलिटी रेट तो 70 का टारगेट है और लेटेस्ट फिगर्स हमारे पास जो 2023 से हैं वो 197 सो फ्रॉम 197 टू 70 इजंट इट अ ओवरकिल जबकि अच्छा अगर खाली बात इस पे होती तो मुझे इशू नहीं था मैं जब थोड़ा सा ट्रेंड देखती हूँ उन्हीं की डाटाबेस पे तो 2000 साल 2000 से साल 2023 तक ठीक है 23 इयर्स और जो ड्रॉप है दैट इज 40% मतलब जो उस वक्त 2000 में मेटरनल मोर्टेलिटी रेट था उससे 40% का ड्रॉप है ना 2023 में तो 23 साल में 40% ड्रॉप्स और अब हम देख रहे हैं कि 197 से 70 ओनली 7 इयर्स इजंट इट ओवरकिल क्या ये रियलिस्टिक टारगेट है
I would say the target is realistic, but we are unlikely to achieve it at the current trajectory.
Mhm.
It is a misfortune. It is a shame. I am lost for words for our statistics in maternal and newborn health. We have performed very badly, both in Millennium Development Goals as well as we don't expect great things for the SDGs either. Uh, it is basically a system failure. Everybody has failed the women and children of Pakistan. You cannot blame the doctors, you cannot blame the government, you cannot blame one particular issue, but overall we have failed. And it is indeed something that needs a major change. And I do not foresee it happening at the moment in my lifetime. When I started as a young house officer, we saw women coming in dying of eclampsia. We saw women coming in dying of PPH, sepsis, obstructed labor, induced abortion. We still see them. Nothing has changed. We are just doing, like आप कहें कि बस मरम पट्टी करके ना मरम पट्टी चल रही है हमारी बस हेडलाइंस हो रही हैं, मरहम पट्टियां चल रही हैं, हमने कोई सिस्टम में हमें एक मेजर कोई सर्जरी की जरूरत थी.
हम्म,
अच्छा, the fact that we have a very high maternal mortality and infant mortality is related to our women empowerment. हमारी औरत जाहिल है. I think we have to be very honest and say that they are illiterate. They have no economic empowerment. They have no say in the health seeking behaviors. It is the family, and they are very low in that particular family structure. So these are facts. The day we admit it, the way we get on with it, start educating our girls, start looking into the hospitals which are practically falling apart. The hospitals are falling apart.
system
They
fails.
are not getting funds.
Hmm.
If you don't have funds, don't have adequately trained, adequate number of staffs, you do not have adequate nurses in this country. You are producing too many doctors and too few nurses. The country needs about 2 million more nurses.
Hmm.
It needs at least a million or more midwives. And we are doing nothing about it.
And nurses are immigrating because they're like lucrative उनको मिल रहा है and they're going out.
I always say that
Yeah.
nurses have better job prospects abroad than doctors nowadays.
Hmm.
But what about this country? What about this country where there are beautiful women, lovely children, and there is a huge fertility crisis? We are an overpopulated nation who has tremendous desire for more children,
Hmm.
whose welfare is nobody's responsibility.
Hmm.
Neither the parents, nor the grandparents, nor the government of Pakistan. They are just being born and left to fend for themselves. No education, no health, no nutrition. And I think I'm being a little over emotional. But I think even now, if I do not speak, then when will I speak?
No, Mama,
But
you're not, you're totally right. You're not emotional. I mean, you're a change maker within the ecosystem. मैं तो एक डाटा देख के डिस्टर्ब हो रही हूँ ना. आप तो दिन रात कितने अरसे से maternal mortality, infant mortality, women health, dying due to other reasons within your gynae ops department, आप उसको देख रही हैं and you're working for it. लेकिन मैं इसको बहुत overkill समझ रही हूँ because targets should always be smart. हमें जो goals मेडिसिन पढ़ाए जाते हैं मैनेजमेंट में specific, measurable, attainable, achievable, realistic, and timely. ये तो overkill लग रहा है. Who are
these
those
are
people who
these
are
are
making
all
those?
achievable. These are absolutely achievable. Sri Lanka, with lower socioeconomic status than us, has achieved it. They are
Hmm.
doing. They are like developed countries. Their maternal mortality touches something like 30 or something
Hmm.
out of 100,000
Hmm.
maternities. But their education is more than 90%. Their health system is robust. They're
Hmm.
poor, but they look after their women.
ये जो
So,
मैं टारगेट देख रही थी.
our
I was
excuse
thinking.
is,
Sorry, आप बोलिए, आप
our
बोलिए.
our excuse is that we are poor. I'm
Hmm.
sorry, we are poor, but we do not have our priorities right. Our woman, our child is too precious. This is the backbone of the country. If you say that you are in the, you have a pyramid and the population pyramid is in to advantage of us, it is only of advantage if it is of skilled people, of
Hmm.
educated people. If
Hmm.
you're going to have huge hordes of uneducated population, it is of no use. It is a
Hmm.
disaster.
Hmm. मैम, ये जो मैंने भी फिगर कोट किया 197 का, ये ग्लोबल है. और ग्लोबली भी देख रहे हैं कि 3 लाख औरतें सालाना फौत हो रही हैं. 3 लाख मदर्स फौत हो रही हैं. तो आप सोचें, मदर इज दिस पिलर सेंटर ऑफ द हाउस. तो 3 लाख खानदान बिखर रहे हैं. वी डोंट नो. हमें डाटा भी मेरे सामने ये नहीं है कि वो जो माँ फौत हो रही है उसके पहले कोई बच्चे हैं या नहीं है. हो सकता है फर्स्ट चाइल्ड, हो सकता है कोई छठा सातवां. व्हाट अबाउट ऑल दोज फैमिलीज? यानी 3 लाख फैमिलीज डेस्परेट एंड डिस्पर्स हो रही हैं
And that
साल में.
is that is international data. For Pakistan,
जी.
our rate is quoted anywhere between 150 to 186. And unfortunately, the latest figures which are circulating these days, we are contributing along with three other nations in Africa to 50% of maternal mortality worldwide.
जी. जी.
That's another dismal figure, which is for you to note. So, same is true for neonatal mortality. I think we are either on the top or the second in the world. And this is a failure that that hurts us. I cannot, face my colleagues from neighboring South Asian countries
Hmm.
who have made leaps and bounds progress. Bangladesh started where we did, and they are far better than us. They are not more rich than us,
Hmm.
but they have their priorities right. While we are more into pictorials and, inaugurals, and but what about the poor woman who's seeking care, or perhaps who's not seeking care, who's dying at home? What are
Hmm.
we doing for that outreach? So I think we have all the solutions. We know the solutions. We do not need more research. The research has clearly told us, and we have data telling us that majority of mothers in Pakistan are dying from postpartum hemorrhage. क्या है postpartum hemorrhage? दौरान ज़चगी खून का इखराज इतना शदीद होता है कि औरत फौत हो जाती है. This is a preventable cause of maternal
Preventable.
mortality.
Yeah.
It is preventable. We have almost 47% mothers dying of PPH, while in Europe, in developed countries, hardly 5% of the women who die in
Yes.
maternal death, because they're preventing all those. They die of unpreventable causes where, they have cardiomyopathy or some embolism which cannot be, somehow be treated timely. So we need to work on really the emergency basis and make it the priority of this country, because as you said, mothers make up the the backbone of the
Yeah.
society.
Yeah.
And it has been reported that if a mother dies, the baby she's born is twice or thrice as
Hmm.
likely to die
To
within two
die.
years
Hmm.
of birth. And the previous children, they also have a higher mortality, the
Right.
ones she leaves behind. Because we all know that mothers basically are the keepers of the house and the children.
मैम कोई ऐसा एलिमेंट या फैसेट है आपकी नज़र में, मतलब बहुत डिस्मल फिगर्स सारे हैं, बट कहीं हम इम्प्रूव भी कर रहे हैं, मतलब अगर जस्ट टू हैव सम
Definitely,
एनकरेजमेंट.
definitely, we are a vibrant nation with tremendous potential. And our doctors, our OBGYN, our pediatricians, they're all sort of working on a very emergency and rapid basis to teach and train and improve the protocols. Every society in this NGOs, the professional societies, the hospitals, everybody's committed. But nobody as an individual can correct the systematic problems.
मैम
If there
इम्प्रूवमेंट
are
की बात, इम्प्रूविंग सॉरी इम्प्रूविंग ट्रेंड की मैं बात करी थी, आपको एक छोटी सी बड़ी मजे की बात बताती हूँ. 2012 में जब सेफ मदरहुड की बातें चल रही थी, सो आई वाज वर्किंग, मैं पब्लिक हेल्थ में आ चुकी थी उस वक्त. आई वाज वर्किंग एज अ मास्टर ट्रेनर, और हमारे जो प्लानर्स थे उन्होंने एक इमरजेंसी ऑब्स्ट्रक्टिव एंड नियोनेटल केयर का प्रोजेक्ट किया 3 डिलेज को प्रिवेंट करने के लिए. सो वी वेंट टू दादू, मतलब सिंध में उन्होंने बहुत एक ऐसी यूसी मुंतखब की जिसमें बहुत हाई मैटरनल मोर्टालिटी रेट था. तो आई वॉज मास्टर ट्रेनर, लेकिन ये है कि जहाँ पर हम लोगों ने ट्रेनर्स ट्रेन किए, उन्होंने आगे से कम्युनिटी रिसोर्स ट्रेन किया, वो घरों घरों में जाके बता काउंसलिंग करती थी. सो मैं किसी दिन रैंडम वैसे ही जाके चेक कर लेती थी घर में कि अच्छा क्या काउंसलिंग चल रही है जो हमारे एंड से थर्ड ईयर पे जा रही है, व्हाट आर दे टॉकिंग अबाउट. सो व्हेन आई एंटर्ड द हाउस, इमेजिन, बड़ा सा कच्चा सा घर था, बड़ा सा सहन, और जैसे ही हम एंटर हुए तो बहुत से बच्चे खेल रहे, और एक साइड पे जानवर हैं, और दो तीन, लग रहा था कि दो तीन भाई रहते हैं वहां पर. दो बकरियां प्रेग्नेंट, भैंस प्रेग्नेंट, बड़े बड़े भाई की बीवी आई प्रेग्नेंट, देवरानी जेठानी, मतलब दो औरतें प्रेग्नेंट, और एक जो नंद आई हुई थी उसके गोद में छोटा बच्चा था, लाइक एक 2 महीने का. सो मेरी नई नई शादी हुई थी, एंड आई कॉल्ड अप माय हस्बैंड. आई वाज लाइक, देयर इज समथिंग इन द एयर, कम ओवर हियर, लेट्स प्लान अ बेबी. But then I came back after 20
always,
days.
pregnancy is a happy occasion.
Yeah.
It is something to look forward to. But unfortunately, if you have rapid pregnancies, you have no intervals between pregnancy, and there is, unfortunately, in Pakistan, the rates of abortions are rising because the uptake of family planning is very poor due to local practices and stigma. And somehow having an abortion is less of a stigma than using contraception in our society. No matter how educated women are, the modern contraceptive practices haven't taken on.
Hmm.
And as a result, the contribution of induced abortions, we don't know how many early pregnancy deaths, has
Hmm.
risen in the latest statistics from about 7% to 13%. So, it is everything is a failure of system. We were told it is going to be magic. We will make population and health ministry one, and then the magic will work and
Hmm.
everything will be fine.
Hmm.
Now they are one, but still we have the same problems, the supplies, the uptakes, the everything is it everything is started with
Yes,
a great
improving
intention, but somehow we do not get to reap the benefits because it gets lost somewhere.
somewhere
Who
in the middle.
started it?
Yeah.
The next person doesn't own it, and then he thinks he can invent the wheel again, and we start all over. So I just hope and pray that
Inshallah.
maybe in a couple of years we'll meet again and we'll say, look, our
Inshallah,
trajectory is
inshallah.
better.
I'll
Our
keep bothering
trajectory.
you. I'll keep bothering you because there are questions that bother me. And mashallah, you're the change maker. So आपसे catharsis भी होगा और आपसे बहुत guidance भी लेनी है because there are some my passionate initiative that I need your guidance on. मैम थोड़ा सा हम change करते हैं इसमें अब हम rural से urban की अगर हम बात करें this is my hypothesis. You correct me if I'm wrong. और मैंने थोड़ा सा उसका data search किया तो चूंकि मेरा hypothesis और मैं research biased हो गई because I was looking for those things जो मुझे नजर आ गई हैं there was research इंशाल्लाह मैं description में वो डाल दूंगी references मैम मेरे ख्याल में hypothesis ये है कि बच्चियां जो हैं पिछले सालों के मुकाबले में जल्दी जवान हो रही है मतलब बलूगत को जल्दी पहुंच रही है जिसको हम precocious puberty कहते हैं और it doesn't stop there यहाँ menarche भी जल्दी आ रहा है because of so many सॉरी मेनोपॉज भी जल्दी आ रहा है या प्रीमेच्योर ओवेरियन फेलियर ज्यादा हो रहा है अर्बन पॉपुलेशन में ज्यादा बिकॉज ऑफ मल्टीफैक्टोरियल आपकी एनवायरनमेंट है आपकी डाइट है वी लिविंग इन अ हाइपरसेक्सुअल सोसाइटी तो प्रिकॉशियस प्यूबर्टी भी ज्यादा हो रही है करेक्ट मी इफ आई एम रॉन्ग इस तरह का आपका एक्सपीरियंस है या ये जो डाटा है हमारा सिर्फ हमें बाहर का ज्यादा है
I would say, I would sort of, if we go into nitty gritty, I'll say the puberty is happening a little earlier all over the world, especially in the hotter climates.
Climate.
So that is true. But precocious per se, I would say that would basically mean less than a 7-year-old or a 9-year-old is getting a menstruation. It is not happening. It is about the same.
Hmm.
However, if you say about premature menopause, early fall in hormones and loss of fertility, that definitely seems to be a problem which I'm facing increasingly. Maybe I'm because as I'm have a special interest in subfertility, so
Hmm.
I see such women more. But definitely, I think the incidence of polycystic ovarian syndrome,
Yes.
the incidence of endometriosis, the incidence of premature ovarian failure, it is all somehow anecdotally it seems to be increasing. We are not keeping actual statistics, so we
Yeah.
cannot really say it with authenticity, but definitely we see it far more. And I basically explain it in the way that when I was in the college, I don't remember a single class fellow who had PCOS.
PCOS, yes. I had
And
one.
now almost,
I had one.
so you are younger
One,
than me, so
yeah,
you saw
down the
one.
generation
And now
one.
the girls are almost 30 to 40% of girls seem to be having some feature of PCOS.
मैम मेरे
And
प्राइमरी केयर में लाइक पहले हम कहते थे ओवरवेट हेल्दी बल्कि उनको अब तो लीन बच्चियों को भी पीसीओस है 2-3 साइकिल्स होते हैं मेनार्की के बाद एंड पीसीओस मोस्टली द
so there
डाइट
is and that has to do a lot with our environment. We have a very polluted environment. We all know of the smog in Lahore. The central Punjab has a major problem of air pollution. And what about our water? What about our plastics? You know, the
माइक्रोप्लास्टिक्स
plastics
एंड
are,
चिकन
yes, they have a major role.
या
Chicken, I'm not too sure, but I think all the poultry, all the meat, everything, even our vegetables, there's so much chemicals and
dirty water
fertilizers.
या
In our cows, we give them so many hormones. Our poor chickens, they eat God knows what. So there is a general systematic pollution and a lot of adulteration you're never sure what you're eating is actually what you're being told. I never know whether the milk I am drinking is right.
Is
I
right.
don't know if it's a chemical milk, it's a real milk, no matter how expensive it is, no matter which source you get it from. So, in a system where adulteration is routine, where corruption is taken as a part of the system, I think we have an uphill task. We have an uphill task. And corruption is not just actually monetary corruption. If you are working in a particular facility and you're not honest to it, that is corruption. If you don't do the hours you're supposed to do during the hours you do not put in a good day's work, I know of so many places where they do 1 to 2 hours of dars during their work time. Dars is basically to be done in your private time.
Private time,
When you're
yes.
at a workplace,
Hmm.
how can you take a 1 or 2 hours?
Hmm.
Study of Quran is tremendous. I study it. Alhamdulillah, God has given me this longevity that I have time after retirement to read about my religion. I'm doing that, but that is my private time. But you cannot do it in your
In
job
your
time,
office
and
time, yeah, yes.
that is
That's
typical of,
corruption. Corruption.
and that is
Corruption.
happening everywhere.
Corruption. Hmm.
Nobody dare talk about it because then you are labeled as a bad person.
Bad person,
Because
yes, yes. The very
no,
fact that
this
I
is a
can't maintain
pseudo
jobs
religion.
on is that I have a
This is a
critical,
pseudo religion. This
yeah.
is not religion of our Rasul Pak. This is not our religion. We are supposed to work in the time when we are working. We are
Hmm.
supposed to pray in the dedicated time.
Hmm. Hmm.
So there's something, and we have to be basically. It is a system change which has to be started. It can start from the bottom. It can start from the top. But
Yeah.
currently,
It needs
all
to
are in the
stop.
same.
But
It
it
has
has
to.
to stop and it has to change. Ma'am, there are so many facets. हम माशाल्लाह आपको देखते हैं कि आप चूंकि स्टेटस पे हैं, ऐसी पोजीशन में हैं, आप पॉलिसी लेवल पे हैं, आपने एकेडमिक्स का पूरा टाइम गुजारा, आप रिटायर हैं, you're in hospital, you're in clinic. हम कोई भी बड़ा मेजर इवेंट देखते हैं हेल्थ रिलेटेड, वुमेन हेल्थ रिलेटेड, ट्विन सिटीज में तो लाजमी, और पूरे पाकिस्तान में, इवन अब्रॉड, you're there माशाल्लाह. फर्टिलिटी हो, इनफर्टिलिटी हो, फैमिली प्लानिंग हो, कैंसर्स हो, you're there माशाल्लाह. बट इतने सारे फोकस एरियाज में आपका अपना पैशन प्रोजेक्ट या आपका एक कॉज जिसको आपको आपको चॉइस दी जाए कि बाकी सब छोड़ सकती हैं, आपने एक कॉज लेनी है या आपका एक पैशन है, व्हाट इज दैट फोकस एरिया among
I
all
think
the women health?
that focus area remains because our bread and butter is reproductive health.
Hmm.
That reproductive health has so many facets, like as you mentioned, cancer, genital tract cancers. Then there is the maternal mortality. Then there is the subfertility. So every facet of reproductive health is evokes tremendous passion in all the gynecologists and the health workers, because I think we are for a common cause, and we have, if you are in the public sector, in the public health sector, it is a life cycle approach.
Yes, yes.
So basically, the day the girl is born till we are in the grave, this reproductive health never stops.
Never stops, and
No.
we are on a roller coaster of emotions throughout our life, the women especially. Ma'am,
So Pakistan ki major problem, if you ask me, is family planning.
hmm, hmm,
It is unburdened fertility. Obviously, I work in infertility, so those who are infertile, they need help. But the
hmm.
basic problem currently is the burgeoning fertility problem, which is not being looked after because of the healthcare seeking behavior of the community. Our community is not ready for limiting their families.
मैम देखिए, हम एज ह्यूमंस, इवन डॉक्टर्स भी, हमारे इनहेरेंट बायसेस या लेट्स से हमारी प्रेफरेंसेस होती हैं टुवर्ड सर्टेन कॉजेज, एंड कुछ जगह चीज़ों के बारे में हम ज़्यादा पैशनेट और ज़्यादा उसको एडवोकेट करते हैं. जब आप एक लेवल पे हैं, जैसे आप, हम देखते हैं कि पब्लिक हेल्थ में नेशनल पॉलिसी लेवल पे भी आप हैं, आप एकेडमिक्स में भी हैं, आपके साथ डॉक्टर्स ट्रेन भी हो रहे हैं, तो हाउ डू यू मेंटेन और स्टे न्यूट्रल while staying passionate to what you have inherent preferences, but policy level पे तो आप biases या preferences नहीं रख सकते ना, you have to be neutral. How do you do that? वो कैसे
Actually,
जगल करती हैं?
I would say that as a clinician, as a gynecologist, we have an advisory role, as an advocacy role. As a policy maker, I don't think I can make a change. But I would be wherever the policy is being made. If I am asked, I am the advocate for the direction that I feel is correct, which may not tally with whatever policy is being made, because policy is dictated by your funding,
Yeah.
by your
Influence of,
manifesto of the
yeah,
government. So many things are there, but
pharmaceuticals.
as advocates, and that is, and the job that you are doing is part of advocacy. Why did I agree? You just gave me a message and I was ready to
Yes,
do
I was
it,
so, yeah,
because
I was so happy for that.
so that is what little we can do.
Yeah.
If this message can reach any one person who can make a difference, any important change that can come through our conversation, I think we've done our job. So it is advocacy. And I
Mm.
think one thing that we have to remember, no matter how dismal the situation, there always is a silver lining.
That's all.
There's always, after a storm, there's always somewhere you can see a rainbow. So we have to continue despite the challenges we have. And
Mm.
I'm sure, because I remember when we were working, we used to work on EMOC, we used to work on different policies. And then one of my colleagues, he's a very good friend of mine, he was a pediatrician, said, Doc, why do you keep jumping into everything and getting into it with all the enthusiasm? I said,
Mhm.
I'll keep doing my bit. Let's
Yeah,
see what comes
that's it.
out.
Let's
I have to
no.
do
At the
my
end
bit.
of the day, you're satisfied, ना कि you've done your part. जितनी आपकी
You have to
potential
try
थी.
your best,
Yes, you
and
have
you
to.
can't
You have to
you
give
can't
it.
do everything. You can't do
You
everything.
can't give up and not get so exhausted कि आप burn out हो जाए. Of course, लेकिन obviously उसके लिए, मैम, अगर कोई एक एडवाइस आपको लगे, जब आज आपके पास पेशेंट्स आती हैं, ये लड़की इसको ये पता होता तो ये इशू नहीं होता. I would want your advice because there's my personal initiative जो कि मैंने brides to be के लिए एक service start की हुई है. It's called premarital counseling और
Zabardast.
brides and groom दोनों के लिए है. But ma'am,
Zabardast.
urban center में भी, even within the family, within my network, मैं कितनी दफा एडवोकेसी कर करके, हमारे पास सब तैयारियां होती हैं, शादी के कपड़े हैं, ज्वेलरी, एवरीथिंग, बट आई टेल देम जस्ट हैव वन सेशन. 1-1.5 घंटे का सेशन है. इट विल नॉट ओनली हेल्प यू इन योर मैरिटल लाइफ, इंटीमेसी इश्यूज, आपकी चेंज मैनेजमेंट, मेंटल कंपैटिबिलिटी, बच्चे किस तरह होने हैं, अपनी, यू डोंट हैव योर ओन साइकी फिगर्ड आउट, हाउ आर यू गोइंग टू रेज अ चाइल्ड. इसमें बहुत सी चीजें हैं, आपकी फैमिली हेरिटेज डिजीजेस हैं, आपके फियर्स हैं, वो जो आइस होता है हमारे, आपकी एक्सपेक्टेशंस क्या है, आइडिएशन क्या है, कॉन्सेप्ट्स क्या है, बैरियर्स क्या हैं. और आपने प्लान पेरेंटहुड पे जाना है, आपने फॉरेन कॉन्ट्रासेप्शन करनी है, बेबी करना है, वो कितनी सारी चीजें हैं. और बच्चों को बहुत फियर्स, उनको लगता है नहीं शादी तो सब करते हैं, उसमें कौन सी कोई रॉकेट साइंस है, हो जाएगा. एंड देन व्हाट हैपेंस, जिनको मैं ज्यादा फोर्स कर रही होती हूँ, उसके शादी के बाद कुछ दिनों बाद मुझे फोन आ रहे होते हैं विद सर्टेन इश्यूज, एंड आई टेल देम, मैडम मैं तुमको पहले बताया था, व्हेन थिंग्स स्टार्ट गोइंग रॉन्ग, एक स्पेशली इंटीमेसी, सेक्सुअल हेल्थ की इश्यूज पे, एक साइकी जो है ना, वो मेंटल हेल्थ की इश्यूज स्टार्ट हो जाते हैं, एंजाइटी स्टार्ट हो जाती है, स्पेशली कमिंग फ्रॉम द मेल साइड, परफॉर्मेंस एंजाइटी, इस किस्म की चीजें. बट सो फार पीपल आर नॉट रेडी टू टॉक अबाउट इट एंड दे थिंक इट्स नॉट यूजफुल, जबकि हम बहुत सी चीजें वहां पर करेक्ट कर सकते हैं, जबकि स्टार्ट होने वाली है एक इंटीमेट लाइफ उनकी. सो वन गाइडेंस
Absolutely.
दैट यू कैन गिव इज,
As you said very clearly, whenever girls come to me and they're newly married and they're pregnant and they're not taking folic acid, and I always say, if your mother had talked to me, if somebody had asked me, I would have said, don't give her anything in Jahez, just give her a folic
folic
acid.
acid, yeah.
Do a HPV vaccination 6 months before she's getting married. So HPV vaccination, it is coming by the end of this year. It will be
Mm,
available to the 9 to 13-year-olds of Pakistan,
mm.
and it is an initiative for 3 years which Gavi is supporting, and that is led by Dr. Sania
Sanya, yeah,
Nishtar,
Sanya Nishtar.
our shining doctor from Pakistan. And so, HPV vaccination, that is another thing you should do for your daughter before you marry her off,
Mm,
because that would protect her from cervical cancer. That is the only cancer which has been found to be preventable if you
Preventable.
give her the HPV
And
vaccination.
neural tube
But
defects as well, मैम अभी मतलब the problem is क्या ये लोग डाल तो देते हैं हम लोग आप लोग टॉनिक्स पे डाल देते हैं but neural
हाँ
tube
हाँ
develops before the woman misses her
that
period
and the
day
folic acid should
21 to
be
29 पे
yes,
tube
so
आती
you
है
have to start it 3 months before you are
before
planning a baby.
baby.
And you start it 2 months after you've got a baby, and by that time whatever was going to happen
Hmm.
does happen.
Hmm.
So things uh, and that is the prioritization and basically understanding, because unless you have, and I say just educating one generation again is just the first step. Once you have, in Germany, they've been almost 100% educated for 500 years. And look at Germany, look at the technology and the kind of population they have. They are indeed uh, they call themselves supposedly in the Hitler time as the Aryans and the superior race. But it is that 500 plus years of literacy which has
Hmm.
made them the top nation of the world. So we are still at a literacy of 30 to 40%, and that too is more of a signature
Hmm.
rather than literacy. So, what about the knowledge? What about the knowledge? So, I think the message
Applicable
is
knowledge.
so the basic message is we should basically be going for an emergency education of this population that we have. How we will do it, I always used to say, I had lots of friends who were who are in the cabinets and who are in the ministries, and we have the same circle. But I always used to say, why not have evening schools in the existing schools? Why
Hmm.
not have night schools in the existing schools? You do not have the money to make more buildings. You do not have the money to do these things. Get volunteers, get people. There are so many people who would volunteer with minimum cost. Get these out of school children. I go for a walk in my area where I live,
Hmm.
and I see whole taxis, small taxi full of about 13 children under 10,
Hmm.
and they offload these beggars, little
Beggars,
children,
yeah, that's a pura
onto the
mafia, na?
streets in
Mafia
the
hai to
morning.
pure.
You
Yeah.
see a motorbike with six people,
Hmm.
and there is a woman with a newborn, and there is another little child, another
Yes,
little child,
yes.
and they are being brought from somewhere to beg into different sectors of Islamabad. You
Hmm.
know, and can anybody do anything about it? No. What is happening? There is serious misgovernance. Pakistan is a country of beggars. We can't get visa to Middle East because the beggars had
The
invaded
beggars.
them and they are not
Yeah.
ready to. So what do we do? We as a nation, we are a very proud nation. We have tremendous potential. We have highly educated, highly accomplished people. Let them come forward. Use them. Utilize them. You have a diaspora. Use them. Get your health and education right. Everything else will look after itself.
We will fall into place, inshallah. Ma'am, I won't keep you for long. आपका weekend है. These are all the points जिसमें हम काफी काफी लंबी discussions कर सकते हैं. And माशाल्लाह, by yourself, आपके अपने level पे, आपने अपनी potential में, you've had a very good, माशाल्लाह, and still continuing excellent career and par excellence जिसको बोलते हैं. बट एज अ पर्सन जो अपने आप को इतना मोटिवेटेड रखता है इतना काम करता है लाइक इनटू एवरीथिंग इन योर कैपेसिटी व्हाट इज द कॉस्ट ऑफ एक्सीलेंस not for patients, for yourself as a human being?
Definitely, it impacts on your health, it impacts on your family. And I think everyone in their journey are privileged. I always used to say it is behind every woman, there is a man, so, or a woman.
Hmm.
या आपकी सास है या आपकी माँ है या आपका बाप है या आपका शौहर है
Sure.
या आपका बेटा है.
Hmm.
So I'm very lucky. I had a father who brought me to where I am,
Hmm.
and I have a son who has really been my lifeline all through. But life has its ups and downs, and I basically have been privileged in the sense that when I look back, I always say whatever happened has happened for some betterment, and you just get on with life rather than you get bogged down by things that happen on the way.
Hmm.
Everybody's journey, I respect everybody's journey, because everybody knows their own path.
Okay.
We always look at another person and say, oh, she's so privileged. And then you when you get to know what is happening in her life, you say, oh my God, I had no business talking this rubbish. So I think appreciate everybody's journey, and basically every woman who you can see has had a difficult time, balancing your children, balancing your family, balancing your even I'm privileged to have my mother who's with me, and I feel privileged that I have her at this age, and I can look after her, and obviously she's there to pray for me. So
Mashallah.
there
That's the
are
biggest
so there.
blessing to have a mother or father who are playing for you. Ma'am, thank you so much for your time. And I am sure कि जितनी भी struggles होती हैं, जितने hardships होते हैं, एक आपका बुलंद अज़्म है और उस पे आपने काम किया है, माशाल्लाह कर भी रही हैं. And I'm sure कि जब किसी बीमार patient का जो उसका लगता था ये नहीं बचेगी, and then after some time you see her just walking with probably a child who's happy. And वो जो खुशी है ना, that is कोई पैसा कोई भी चीज उसको उसको सेकंड नहीं कर सकती.
Alhamdulillah.
वो अल्हम्दुलिल्लाह जो अल्लाह ने एक चीज हमें दी है, जो अता की थी, शिफा में जाने अल्लाह है, लेकिन अगर हम उसमें कोई टूल बन गए हैं उस पूरे प्रोसेस में, आई थिंक इट्स द बिगेस्ट ब्लेसिंग वन कैन हैव. So alhamdulillah, and thank you so much from the whole nation for your services. Inshallah, I'll keep on bothering you. I had a wonderful
My
time.
pleasure. My
I had a
pleasure. Good
wonderful
luck on
time.
your
Thank you.
task.
Thank
Bye
you, ma'am.
bye.
Assalamu alaikum.
Allah Hafiz.
Allah Hafiz. Allah Hafiz.